Paton. I'm a course director in the Faculty of Science at Sturt University. As a part of that role I oversee the Master of Speech Pathology alongside a number of other allied health courses. So I also look after physiotherapy, occupational therapy, speech pathology, our Bachelor Speech Pathology program, and health and rehab science and podiatry. So speech pathology, and you probably know a little bit about speech pathology if you've come along to the session today, because hopefully you've done a bit of research about the profession. Speech pathology is a profession that sits under the banner of allied health courses. And allied health courses, I incorrectly say, but it's kind of an easier way to understand what an allied health professional is. Allied health professionals are pretty much anyone working in health who's not a doctor or a nurse. So a speech pathologist, or sometimes they're called speech and language therapists, sit under that banner. So today I'm going to be talking about our master program. So that means you have to have a bachelor degree or undergraduate qualification to be eligible for our master program. And I'll talk about the admission requirements a little bit later. I'll be talking about the Master of Speech Pathology, which is an allied health degree we have here at Sturt University. I'm a physiotherapist myself, so I've worked really closely with speech pathologists and know a lot about the profession. So I'm going to be talking a little bit about the program in general and how this program can position you to work in pretty much any kind of speech pathology setting. Sturt University has a commitment to preparing students for regional and remote and rural settings, but we also prepare you to work in metropolitan settings. So if you want to work in a city, you will graduate with the qualifications to do so. If you have any questions along the way, pop them in the chat box, and otherwise you can, while we've got a relatively small group, you can sing out, but if that does grow too much, I'll ask you to just pop them in the chat box so that we don't have people talking over the top of each other. Like I said, I'm a course director, so that means I oversee a lot of different courses, and I not only look after speech pathology, but I also still work very closely with speech pathologists in a local hospital. So I have a lot of respect, and I think it's a great profession, and it's really exciting if it's something you're thinking about doing with your career. If at the end of this presentation and after the questions section you still have unanswered questions, you can always get in touch with me, and I think I provide my email details later on in the presentation, so you can get in touch if you've got any more questions. Otherwise, I'll pop it in the chat box for you. Just starting with Yingyamara Wunangara, which is basically the heart of everything we stand for here at Sturt University. And it's the reason why we strive to create a world worth living in. And health professions, health services are incredibly important for that. And we know that there's a big disparity in Australia for health services, particularly in rural and remote areas. And Sturt University is committed to improving that. And I'll talk a little bit about what that means for you as a Master of Speech Pathology student here at Sturt University as I go on through the presentation. Before we go any further, we'd like to pay our respect to all First Nation elders, both past and present, from the lands where Sturt University students reside. In particular, we acknowledge the Wiradjuri, Ngunnawal, Gundungurra and Biripi people of Australia, who are the traditional custodians of the land where our campuses are located, and also acknowledging the traditional custodians of wherever you might be, understanding that we're all over the place at the moment, and not necessarily working from campuses like we normally would. So why study at Sturt University? You can take your study anywhere, and I'll talk about this in a little bit about the Master of Speech Pathology course more specifically, but the idea of a Master of Speech Pathology course is it's not an online course, it's a blended course, because to learn how to be a speech pathologist, you actually need to put your hands on people and practice on people and learn hands-on skills. So with the Master of Speech Pathology, you'll do a lot of stuff online in the comfort of your own home, flexible hours at the times that suit you. But then across the tenure of the course, you will come and spend some time on campus learning those hands-on skills, practicing on real patients and spending some time with the academics that we have here at Charles Sturt University. So it's kind of what we call more of a blended program, in that you do lots of your stuff online, lots of study online in your own time, and then you'll come and spend some time on campus for the compulsory residential schools. You'll spend some time in the on-campus clinic, actually working with real-life patients, and you will also spend some time on workplace learning or placement. And there's two big placements as a part of the Master of Speech Pathology program. One of those we try and get nice and close to you so that you can commute to it, understanding that it's really hard to be away from families, be away from home for a long period of time. But to make sure that you get the breadth of experience that you need, one of those placements you will be required to probably travel to and stay somewhere for that period of the placement. And I'll talk a little bit about placements later on. So even though most of the study or a lot of the study is online, you can still access all those things that are really important on campus. So there's the library that you can access online. There are academic support people who can help you with your writing and your study, and you can access all those things online, which is really great. We're the #1 university for online study, so the Master of Speech Pathology really, we're highly skilled in providing that online learning experience as part of the Master of Speech Pathology. Fit study around your life and your needs. Like I said, you can fit your study in around everything that's going on at home, and just organising for when you need to come to campus. And I'll be a little bit more specific about how often you need to come to campus a little bit later on. We have close connections with the industry, so our course is developed in consultation with the speech pathology industry. So we have an external advisory committee, which is made up of speech pathologists, it's made up of students, it's made up of other academics, who we meet twice a year and talk about the course, talk about the content within the course, and make sure that what we're teaching and what we're providing our students is contemporary, and making sure that you're ready for, or making sure graduates are ready for contemporary practice. So it's an up-to-date program. Our speech pathology lecturers, most of them have doctorates, so they've done they're doing postgraduate research, postdoctoral research in speech pathology areas. We have internationally recognised speech pathology researchers within our academic team, as well as clinical educator academics, so academics who are still working in the field. So we've got a really great broad range of skill that we'll be teaching you across your experience in the Master of Speech Pathology program. So like I said right at the beginning, to qualify for or to enter the Master of Speech Pathology program, you have to have an undergraduate bachelor degree in something. It can be anything, as long as it's a recognised AQF level 7 degree here in Australia. You can apply for entry into the Master of Speech Pathology program. We get lots of teachers, we get lots of psychologists. What else do we get? Lots of teachers, psychologists, arts, people who might have studied arts, but we have had people who've done engineering, some really random ones come into the program. So it doesn't necessarily have to be a health related area that you've studied or education related area. As long as you've got a suitable bachelor degree, we will look at your application. Applications open, if they're not open now, they will open soon and close on the 30th of September. And that is a hard deadline for us, because we get upwards of 200 applications for a maximum of 50 places, and it's a really competitive application process. So when you apply, you will need to provide proof of your bachelor qualification, and you'll also have to provide a 500-word statement that gives us a bit of information around your experience with online learning, how you are going to be successful in this degree, and what's motivated you to study this in the first place, because we want students that are going to be successful, and because we have such a strong pool of applicants, that statement is really important in differentiating who comes into the program and who doesn't come into the program. We are accredited by Speech Pathology Australia. We have undergone accreditation. We submitted our documents last year. We had a really successful accreditation visit in March, and will be fully accredited as long as we just provide a little bit more information, which we're collating at the moment. So we're really excited about that. And that means you can register as a speech pathologist with Speech Pathology Australia once you finish the course, which, to be able to practice, most employers require you to be able to register with Speech Pathology Australia. The course takes about 3 years to get through. It starts in a part-time mode, so all students start off part-time for the first year and 3/4, and then you have the opportunity to fast track and go full-time if you want to finish within the three years. It's called 3.25 years because there's a summer within that 3 years that you will have subjects you need to complete. So although it's kind of finished within a 3-year period, there's an extra session of study within that, which puts it up to the 3.25 year time that it takes. You can leave after a year and a little bit with the graduate diploma of speech and language. That doesn't allow you to practice as a speech pathologist, but it allows you to practice as a speech pathology assistant. So it can be a really handy qualification if you feel like you're not going to get through the whole 3 and a little bit years. You have around 7 years, or students have around a maximum of 7 years to complete their studies. But if you look like you're going to take that long, you might have to do a couple of extra things along the way just to make sure your skills are updated and you haven't forgotten everything that you studied in first year. And that's one of the things I work really closely with students and the speech pathology team to make sure that all the students are current in their skills. We have a session 1 intake. So if you are interested in applying, it will be for the 2021 cohort starting in March. And it's online mode, although we call it more of a blended mode because you are required on campus a couple of times during the year. There are a number of subjects that contain workplace learning within the course. So like I said at the start, there are 2 6-weeks or approximately 6-week placements. That's SPH 515 and SPH 525. And one of those we will try and get close to home for you, and one of them you will likely have to travel for because we need to make sure that you get a breadth of experience, and that's a requirement from Speech Pathology Australia. We organise all your placements for you. It's really important because there are lots of speech pathology students in Australia, and organisations don't appreciate students randomly ringing them up and trying to organise placements. So we have partnerships, paperwork, contracts, registered clinical educators, all those sorts of things organised across many, many, many different organisations, and we will organise your workplace learning for you. And we also have to make sure that you get that breadth of practice. So practice across an adult population, but also a paediatric population. And that's one of the requirements with Speech Pathology Australia. SPH 505 and 511 are spent in the on-campus clinic in Albury. So we have an on-campus clinic where real-life students, real-life patients come through, and you'll spend time supervised by clinical educators, spending time with those patients. SPH 505 is 3 weeks in the on-campus clinic in Albury, SPH 511 is 4 days in the on-campus clinic, and then you do 4 days of online observation, so you can do that from home. And 515 and 525, like I said before, are 6 weeks. We also have residential schools. So like I said before, it's like a blended sort of course where you do most of your work at home in the comfort of your own home and in your own time, but you'll be required to come down to Albury and spend some time in the residential schools to make sure that you can learn those hands-on assessments, treatments, interventions, all those sorts of things. So for SPH 511 has res school, 512, 513, 525, 528 and 529. And all that information is available if you just Google CSU Master of Speech Pathology. You'll be able to see all that information around the residential schools. And we have accommodation available in Albury for you if you need it. CSU has lots of scholarships. It's definitely worth having a look to see if you qualify for any of those scholarships, and there's sort of a one-stop website to look to see if you qualify for the many scholarships that we have. So I'd strongly encourage you to do that.
Thanks everyone for joining us this afternoon. My name's Jack Cannon and I am the Discipline Leader for Exercise Physiology at Sturt University. During this presentation, I'm only going to go for 15 minutes or so, hopefully give you a few opportunities to ask a few questions and clarify anything that I've said, but specifically we're going to be talking about the Master of Clinical Exercise Physiology. Now, for this particular course, it's a very popular course, and what I've done for this presentation is provide you with a general overview in terms of how the course is structured, its major aims and objectives, how it all generally works, what the admission process is, and also try and clarify a few issues that we sometimes have with students understanding about the course and ensuring that if you are interested in applying, then everything will run nice and smoothly for you. If you have any questions at all, as Katie mentioned, please drop them in the chat box. Otherwise, as Isabel mentioned, there's only a few of you here, so by all means, jump in and ask a question. I'm more than happy for you to interrupt me throughout the presentation as needed if you have any questions. So in terms of myself, I'm a senior lecturer, as I mentioned, and also the discipline leader of exercise physiology here at CSU. I've been at CSU for about 15 years now, so quite a while, working within the School of Exercise and Sports Sciences and Health. In terms of my background, I've got a PhD in exercise science, specifically looking at the benefits of resistance training for muscular strength, neuromuscular adaptations and functional improvements in elderly women. And I'm also an accredited exercise physiologist as well. So have some practical clinical experience as well in this context. My primary area of research is looking at neuromuscular adaptations to a range of different contexts, be that exercise, be that the effects of aging or detraining or disuse, also fatigue, be that related to exercise in a sports and performance context, or also more recently I've been looking at clinical fatigue in clinical populations such as cancer fatigue, fibromyalgia, and other type of fatigue related conditions. So that's a lot of my interest, and again it quite often relates and works back with a clinical context. Yindimara Wing Yanganamara is a Wiradjuri term or Wiradjuri phrase which Charles Sturt University has taken on board, and that term essentially provides a really good vision and collective statement that represents the entire values across Charles Sturt University in terms of what we are here and what we are trying to achieve. The term itself essentially means the wisdom of respectfully knowing how to live well in a world worth living in, and as I mentioned, it does sum up everything that we do across the university. It is the core value statement, if you like, in which everything across the university is designed and measured against. Now, from our context within this particular course, The Master of Clinical Exercise Physiology is an allied health qualification. And basically what that means is once you complete this qualification, then you will come out as a registered health practitioner. You'll be able to get access to a Medicare provider number, so you'll be able to receive Medicare remunerated services and referrals from GPs, specialists and other healthcare providers, as well as be able to provide rehabilitation services for a range of different insurance related schemes, including the State Insurance Regulatory Authority here in New South Wales and others across various states in Australia. So health is a really big issue, obviously, with respect to that hereditary phrase, and it's something that we really do work hard to try and achieve within this particular course. Just before I do commence the presentation with specific respect to the course itself, I'd just like to pay acknowledgement of country. We pay respect to our First Nation elders, both past and present, from the lands where Charles Sturt University students reside. In particular, we acknowledge the Wiradjuri, Ngunnawal, Gundungurra, Biripi peoples of Australia, and those who are the traditional land owners and custodians of the campuses in which we are located. So to kick us off, why study at Charles Sturt University, and particularly why study the Master of Clinical Exercise Physiology? There's a few things with this particular course. First thing is that this course really can take you anywhere. Clinical exercise physiology is a relatively new allied health profession, and particularly in Australia, we really are at the leading edge of this developing profession. Australia is essentially only one of 3 countries worldwide which actually have clinical exercise physiologists formally recognised within government legislature that allow them to receive government payments, i.e. Medicare referrals and Medicare subsidies through government insurance schemes. Other countries, exercise physiologists are all working in private practice essentially and working directly with patients but aren't eligible to receive any government subsidies. So Australia is really at the forefront of trying to get clinical professionals who specialise in exercise to work with patients with chronic disease and a range of other chronic injuries and disabilities to try and enhance their health outcomes to improve their quality of life and also their health status. Now, this particular course, as I said, can take you anywhere. We have graduates that have completed this course that are working all over the world. Some are in New York, some are as close as New Zealand, others are working in Europe, in the UK and so forth. So our graduates do end up in a wide range of different places. They're not just located within Australia. The course itself is available online, primarily that is complemented through some compulsory residential schools that we also include to ensure that our students are able to develop the practical skills required to work with patients in a clinical setting. Obviously, exercise is quite a active form of intervention. So, at some point or another, you will be working with clients and working with patients and real people as a part of this course, either interviewing them and performing initial consultations to determine what their health needs are and what their exercise interventions and exercise rehab programs might actually require, to exercise testing, to actually delivering exercise and also reviewing clients' assessments to determine their progress and so forth. So you will be working with people within this particular course. So it is available online, but you will be required to attend campus at some point or some points to undertake some of those practical skills and develop your skills in those areas. Charles Sturt University is Australia's leading online provider of education. We've got more than 70 courses that are available online for students to go through and complete, with the Master of Clinical Exercise Physiology being one of those courses. The course itself being online obviously allows you to complete your study anywhere. Not only do we have graduates that have gone to obtain employment in a wide range of far off destinations, we've also had students studying the course from a range of destinations as well. Because all you really need to complete the online component is obviously internet access and a computer, then we have students, leaving with family, for a number of weeks or a month or so overseas, due to personal circumstances, and are still able to complete their studies while they're overseas, and then come back. We've also had a number of other students who have actually been enrolled in the course who have actually been located overseas. We've had a couple of students from India, as an example, enroll in the course and complete it. So the course is really accessible to anyone who would like to get in and do it, provided that they are able to complete those on-campus residential school components. With the course being online, obviously, you're able to fit your study around your lifestyle. The way the course has been designed and the way that our subjects are delivered is that you will complete all of the online coursework components throughout the typical sessions of study. The residential school components occur at the end of the semester. So you won't be required to regularly, attend campus every 2 or 3 or 4 weeks. You'll attend campus once at the end of the session after all the online study and all the online coursework has been completed after the final exam period. And this is what makes the course really flexible for students. Because you really can do it anywhere during the teaching session. As a group of staff members, we're also really flexible with students. We understand the demands that this places on you when you're trying to juggle family, work commitments, and also any personal responsibilities and things that you may have on your plate. Things can get really difficult trying to juggle all of that with your study as well. And we are really flexible and accommodating with students in a range of different areas as best we possibly can. Obviously work does need to get done, and at some point there will be some deadlines around assignments being due, but our staff are really, really flexible, and we work closely with students. We try to get to know everyone really well and work with people as best we can. So if you have any problems or something pops up during the semester, by all means, contact your subject coordinator, let them know what's happening, ask them for some help, and they'll be more than happy to try and provide you with some suggestions or some support to assist you through. And we really value that connection with students and being able to provide students with that level of support. That's really important to us. So the course is great in that regard, in trying to assist you to be as productive and as successful in the course as you possibly can be. There's no benefit for us to have you fail and really struggle in the course. We really want you to get through, and we do our best to support you as much as we possibly can. We have a number of connections with the exercise industry. Half of our staff members that teach within this particular program are accredited exercise physiologists and do have current clinical experience. Quite a number of us are still undertaking clinical work, so we work in our exercise physiology clinic, a couple of days a week, as our teaching arrangements allow us. So we're all quite current in terms of our clinical skills and working with a range of different clients. We also have a number of casual or sessional academic staff that assist us to deliver the program, particularly during our residential schools. And during our residential schools, we try and get people with extensive clinical experience to come into campus to work with you during those residential schools. Just to give you an example, one of the subjects I teach is exercise for cancer, exercise prescription for cancer management. For that residential school, I've previously had 3 very, very experienced exercise oncologist clinicians actually come to campus for the day and work with you to develop your skills around developing exercise programs for people with cancer or a history of cancer. And that's essentially all those people do. They work full-time in the exercise oncology context, either within a hospital or within private practice, but that is their bread and butter, and that's essentially all they do. So they're very, very experienced. You're getting really good teaching from people with up-to-date current clinical experience working with those particular patients. And that occurs across all of the subjects that we have within this particular program. Having that clinical input and having that direct contact with industry is really important for us to make sure that you are able to get the skills that you require to go out and practice successfully once you graduate. So as I mentioned before, there's a number of benefits, for why Charles Sturt University is a great place to study, but also why the Master of Clinical Exercise Physiology might be a good fit for you if you are looking at working in this industry. Course is online, it's very flexible, the academic staff are incredibly approachable and friendly, and you'll get to know us really well by the time you graduate and finish the course. Employment opportunities in the exercise physiology field are just expanding. At the end of the day, the Master of Clinical Exercise Physiology is designed to help people develop and deliver and implement clinical therapeutic exercise programs for people with chronic and complex disabilities and injuries. So people with a range of health conditions such as cardiovascular disease, musculoskeletal injuries or conditions, cancer, neurological health issues. We address all of these individual pathologies within the course. And obviously, with the Australian population ageing, continuing to age, and people living longer, our services are just becoming more and more demanded, to try and improve the health of the nation. So this is definitely a growing field, and it's just boomed in the last 5 years or so. So there's certainly plenty of employment opportunities in this area, and it's a great place to work. It's a dynamic profession. You've got great support bases, both within the industry professionally, and also within your team of academics that quite often keep in contact with students after you graduate. So this really is a great place to be. So specifically with the course itself, if we start talking about now, how it's structured, how it's designed, aims, objectives, and so forth. So our Master of Clinical Exercise Physiology at CSU is Australia's only online accredited exercise physiology course within Australia. So in order to become an accredited exercise physiologist and get that Medicare provider number and get your provider numbers with other insurance providers within Australia, you need to be accredited with Exercise and Sports Science Australia. So ESSA is our peak governing body for our profession. And this particular course at Charles Sturt University is at the moment the only Master's Exercise Physiology course which is actually accredited that will allow you to receive those qualifications. All the other master qualifications in exercise physiology are all on campus and require you to study internally. So this particular course is unique, and it's the only one of its kind within Australia. As I mentioned, the course is fully accredited with Exercise and Sports Science Australia. So once you graduate, you'll be guaranteed to be able to get your Medicare provider number and access services from those other insurance providers as well once you graduate. So once you complete the course, there's nothing else, there's no further study and so forth you need to do other than fill out some forms, send them through to ESSA. They will then give you your provider number and your registration number, which then you can then apply to Medicare, apply to CERA and a range of other organisations to get your approval. Depending on the type of work you want to do, there may be some additional online study that you need to do or components that you need to complete to meet their registration requirements, but that is no different to any other allied health professional. So physiotherapists would need to do it, occupational therapists would need to do it as well. So it's not unique to exercise physiology. We're recognised on the same level of footing as any other allied health professional in that regard. This particular course itself is a very popular course. We have a number of students, quite a number of students applying to study it each year because it is so convenient and flexible for the fact that people are able to do it at home. And for the fact it is a master's qualification, you can actually get the course completed within 12 calendar months, depending on how you enroll in your subjects. And I'll talk more about that in a moment. The reason why I mention that is because our entry requirements are very specific. And in order for you to gain entry into the Master of Clinical Exercise Physiology at Charles Sturt, you need to have completed an ESSA approved undergraduate qualification in exercise science. And that undergraduate qualification is important because it tells us that you have completed all the prerequisite learning necessary to be successful to, one, complete the course, and secondly, to meet the exercise physiology accreditation criteria once you graduate. So that's really important. I'll talk more about that in a moment. As I said before, all of our academics have industry experience. Half of us are still currently accredited exercise physiologists, and we're all active researchers within the field. So you're being taught with a range of academics that have a lot of experience and are able to assist you to achieve the course outcomes and provide good, sound learning experiences for you as you complete the course. So looking at the duration and the structure of the course, as I mentioned, you can actually complete it in 1 calendar year. Technically speaking, the course is 1.5 years in duration if you study full time. And the reason you're able to complete it in 1 calendar year is that the course is made up of 3 sessions of study, but those 3 sessions are all completed concurrently. Or consecutively. So you complete session 1, session 2, and session 3. So study autumn session, study a spring session, study a summer session, and then you're done. Start in February, finish in February the following year if you study full time. If you study part-time, it will take you 2.5 calendar years because that initial summer session is no longer completed until the end of your 2nd year. I'll explain the course structure in a moment. Course intake is end of February, early March in most sessions, and we only have the 1 intake every year. So it's important to make sure that if you are interested in applying for this course, that you do get in early and prepare and get organised because you need to get it all in at the one particular point in time. You haven't got another option 6 months later to have a mid-year intake. So it's important to make sure that you do meet the admission deadlines and so forth. Applications for studying the course for 2021 will close on November 30 this year. So it's important to make sure that you make a note of that deadline. In addition to that, when you apply for admission, you need to also provide evidence that you have been approved for a graduate entry assessment by ESSA. Now, the graduate entry assessment is something separate that you will need to do. Jump on the ESSA website. It's very, very easy to find the information. Just Google it. Download a graduate entry assessment form, complete the form, attach your transcript from your undergraduate exercise science degree, send it off to ESSA, and they will review it. And they will send you back a letter that either says one of 2 things. It'll either say that you've been approved and nothing else needs to be done, and that's fantastic. You then attach that letter to your application and send it into the university, or it will outline any gaps in your undergraduate course that you may need to complete prior to getting entry into the course. So it's really, really important to make sure that if you want to apply for this course, that you do apply for that graduate assessment entry to ESSA by the end of July. So that way it gives you 3 months to get that assessment completed before you actually need to submit your paperwork for admission to CSU for entry into the Masters by the end of November. If you have any questions at all around that, please look at the online course brochure. It's very, very clearly described in terms of what needs to be done. I would simply highlight the timeline to make sure that you give yourself plenty of time to get that ESSA graduate entry assessment completed. A lot of people leave it to the last minute and they don't have that graduate entry assessment back from ESSA prior to the course actually closing. Now, that doesn't mean that your application won't be considered for entry. But what it means is that you'll be put on the bottom of the pile. Those students that have all the paperwork completed by the application deadline will be given first preference for entry into the course. So to give yourself the best chance of getting in, please make sure you get in and complete that paperwork. It is relatively quick and easy to do. It doesn't take long, very straightforward, but it is something that you need to make a note of and be aware of to ensure you get it done in a timely fashion. Okay, just a quick question here that somebody sent through. I'm currently doing a Bachelor of Science. I've majored in physiology and done an exercise physiology unit. Does this apply to the ESSA science standards? Actually, yes, it certainly could. I can't tell you exactly what units that would actually cover, but by all means, I would imagine there'd certainly be some units, anatomy and physiology as an example would certainly be covered. My suggestion will be to apply to ESSA for that graduate entry assessment. Get that done now. You wouldn't have to wait. If you've completed that undergraduate degree in Bachelor of Science, get in and do it now. And that will just give you plenty of lead time to make a decision on what you can do depending on what ESSA come back with. Now, I haven't actually got it mentioned here for this presentation because we're talking about the Master of Clinical Exercise Physiology, but there are a number of students in your situation. We've had nursing students try and get entry into the course, as well as people from other allied health professions, or have done allied, other health-related degrees, radiation sciences and so forth. To try and help those people who haven't done an exercise science degree get entry into the course, we offer a diploma of exercise studies. And that diploma is for people who are missing a few subjects that need to fill those gaps. So get your ESSA assessment, identify what gaps you may have in your studies, and then that the diploma of exercise studies offered here at CSU might be able to assist you to complete those gaps and get everything completed. So just have a look for that. I'm happy to talk offline a little bit further about that process if that's something you would like to do. In terms of the course structure, we have the course is made up of 9 subjects. This is the full-time pattern on the screen at the moment. So 4 subjects in session 1, 4 subjects in session 2, and then you complete all of your workplace learning in that summer session over session 3. The subjects that I've identified here with an asterisk, so there are 2 of them in session 1 and 4 of them in session 2. And also the subject in session 3, all have compulsory residential schools. And I'll talk about those in a moment. Part-time structure is obviously split, so you're only doing half the subjects in each session. So 2 subjects in session 1 of year 1, 2 subjects in session 2 of year 1. You don't complete any subjects over session 3 in year 1, and then you do the balance of those subjects in sessions 1 and 2 and 3 in your second year. So session 3, 4 and 5 respectively. You can mix and match also if you'd like to commence the course part-time, which all distance education students are initially enrolled in by default. You can then change your enrolment to study full-time or vice versa, commence full-time, but then drop back to part-time if that works for you, provided that you get the entire course completed within the maximum enrolment period, which is, for this particular case, it's 6 years to complete for this particular course. The residential schools specifically occur at the end of the session after the final exam period where appropriate, after sessions 1, 2 and also sessions 3. The residential schools will typically be 1 to 2 days in length, depending on the subject, and they'll typically be from 9 AM to 5 PM. So they're fairly busy residential schools. We've got the residential school structured so that all of the subjects being completed within a particular session will run consecutively. So you only need to come to campus for the 1 week to get all of your residential school components completed for each of the subjects within a given subject, within a given session of study. So it just keeps things convenient. You only need to travel once for each session to get all the residential school components completed, and all residential schools will be completed on the Bathurst campus. So the majority of our students, a lot of them come from the east coast of Australia, particularly the Sydney Central Coast region. So it's essentially a 3-4 hour drive for most students. So it is quite manageable in that respect for a lot of people. If you live away from those regions, then you can certainly fly in from Sydney if you're located over on the West Coast or somewhere a little bit more distant from the Bathurst. In terms of workplace learning, to become an accredited exercise physiologist, you need to complete a total of 500 hours of workplace learning. Now, those 500 hours are broken up into two primary categories: 140 hours working with apparently healthy populations. In most cases, those 140 hours will be completed within your undergraduate course, within your undergraduate exercise science course. If you haven't completed an exercise science course and you haven't been able to get those healthy hours completed, that's okay. You can also complete them within the Master of Clinical Exercise Physiology prior to completing your clinical hours. So we can allow for that. If it takes you a little bit longer to get those hours done, that's fine. We can support you in getting those done. And in addition to the 140 apparently healthy hours, you need to complete a minimum of 360 clinical hours. Now, those 360 clinical hours must be completed. All of them must be completed within the Master of Clinical Exercise Physiology. We can't give you recognition of prior learning from hours that you've done outside of the course. It's an accreditation requirement. They are done within the course. Those clinical hours are also broken up into a number of pathology domains. So you'll be required to complete so many hours with cardiopulmonary patients, so many with musculoskeletal, so many with neurological, and so forth. So by the time you finish those 360 clinical hours, you'll have a range of experiences across the majority of the primary pathology domains that you'll be likely to encounter and work with as an exercise physiologist once you graduate. Our placement team works very hard to ensure that we have a large number of placement organisations spread right across Australia. So there's a very, very good chance that we'll be able to find placement locations that are relatively close to your place of residence, so that you won't be required to travel or undertake, get accommodation and travel away from home for extended periods of time and pay for accommodation and so forth to get your placement hours done. We've got a very strong team with a big network of organisations that we work with, and we're able to support most people in the vast majority of cases to get those hours completed very close to their home, so they can be home and they don't need to travel for extended periods of time to get that done. So we work very hard to support students in that regard.